Welcome back to In Focus. It's time now for our In Focus Health Update.
And Linord Moudou joins us now with a look at what Togo is doing to fight HIV/AIDS. Hey, Linord.
Hello, Vincent. Hello, Dimiake. Well, during a recent visit in Togo, UNAIDS Executive Director Michel Sidibe says the country has made some progress in tackling HIV/AIDS. Concluding a two-day trip in Togo, UNAIDS Executive Director Michel Sidibe praises the country for progress made in stabilizing the epidemic of HIV and reducing new infections by 28%. However, Sidibe says money for AIDS need to be managed carefully.
Comment utiliser les ressources financières qui sont déjà mobilisées?
How can we efficiently use the financial resources that are already in place to maximize on results? We need to make sure that the funds are used in an appropriate and transparent manner, and make sure that there is less red tape when it comes to the supply of medicine.
Dans l'approvisionnement des médicaments.
Sidibe also lauds the government on the Lomé-Cotonou Corridor project. Thanks to the project, some healthcare centers have been set up at the border between Togo and Benin to provide counseling and condoms for truck drivers and others nearby.
C'est une initiative qui est unique.
I would like to say that the Lomé-Cotonou Corridor is a unique initiative, and the fact that these healthy centers on the border not only provide services to the surrounding populations, but the populations who migrate from place to place. We know that it's an area that can be dangerous, in the sense that the dangers are enormous for those who move from place to place.
Government figures indicate that 80% of Togolese know about HIV prevention and transmission. Access to antiretroviral drugs has more than doubled in the past 4 years, with more than 25,000 now receiving care. The UNAIDS Executive Director's visit to Togo is part of a 4-country mission to Benin, Ghana, and Côte d'Ivoire. Well, a lot of improvements have been made in the prevention and care of HIV/AIDS in the past 30 years. Scientists are continuing to look for innovative ways to tackle the disease. Now joining us via Skype with more on a groundbreaking development is Waaqo Daddacha, PhD candidate at the University of Rochester Medical Center, Microbiology and Immunology Department, and Dr. by Kim's Laboratory. Mr. Daddacha, welcome to the program.
Thanks for having me.
Now tell us, what is the major finding of this study?
Yeah, our study, which was conducted by collaboration between international labs from France and including France and the United States, was focused on understanding how some cells in our body restrict HIV infection. And our results show this restriction is achieved by limiting or reducing the cellular DNTP pool, which is the DNA building block of DNA.
Now, can you explain this process, how some cells can restrict HIV by denying it the building block of DNA?
Yeah, basically, our cells and also viruses, as well as cellular pathogens have got something in common, and one of these is the need to synthesize or make their DNA in order to reproduce. And this DNA is made up of the building block known as a DNTP, or deoxynucleoside triphosphates. And actually, these viruses like HIV and others, they don't have these DNTPs, so they use what is present in our cells. So our finding does indicate or show that some cells in our body, actually the primary target cells for HIV, like macrophage and dendritic cells, do express the protein which reduces this DNTP pool, and by doing so, they will deny the virus this building block, making it difficult for it to reproduce itself.
That's very interesting. One of the challenges that experts have said over the years for finding a cure for HIV is the fact that the HIV virus mutates. So can your findings possibly address this challenge?
Yeah, that's a great question. As you mentioned, the major challenge to cure HIV infection is the ability of this virus to mutate or change itself rapidly. And by doing this, it's make it very difficult to fight against it through our immune system or even a drug by developing a resistance to most of existing drugs. And actually, scientists have been looking or searching for the mechanism that our cells use to restrict this kind of infection. And finding one is exciting news. Actually, exciting thing about this finding is that this will open a door to explore a drug targets in our cell components instead of the virus itself.
Oh, okay.
And by doing this, we may be able to bypass its mutation ability and maybe finally getting something that may lead to the cure.
Okay, as you said, exciting news. And quickly, how long will it take before these findings are translated into a treatment?
This is a challenging question, and actually everybody likes to know this. But actually, this study it's in an early stage, and by this time, it's very difficult to know whether we can use this mechanism as a possible drug target. But I wouldn't rule the possibility. And also, if this mechanism could be a possible drug target, actually it will take a very long time to be translated into treatment that could be used in humans.
Wonderful. Well, thank you so much, Mr. Daddacha, for your insight in this new groundbreaking study. And that was Waaqo Daddacha, PhD candidate at the University of Rochester Medical Center in Rochester, New York.